Hello, I'm Dr. Elizabeth Brooker. During my PhD research, I assessed the longitudinal effects of cognitive hypnotherapy and eye movement desensitization and reprocessing on trait anxiety and the effects of this on piano performers at an advanced level. Previous research into trait anxiety, both in the field of music and in the broader field of anxiety conditions, has largely focused on the conscious mind. However, my research focused on the unconscious mind, on the implicit cognitions, emotions, and memories no longer consciously perceived. So what is trait anxiety? Well, it's an individual's general level of anxiety. It's thought to be genetically based. However, it can also be influenced by personal life experiences. So it can be thought of as a combination of these two things, and is believed to be non-mutable or unchanging. And research has shown that individuals with high trait anxiety are more susceptible to stress, experiencing enhanced cognitive anxiety and psychological and somatic and physiological symptoms of anxiety. They will experience higher levels of state anxiety when faced with an uncomfortable situation. And Joseph Ledoux has written widely about this in his book, The Emotional Brain, published in 1996. So CH and EMDR are therapies that focus on implicit or unconscious processes no longer consciously perceived. And by this means, they get to the root cause of the problem. Both desensitize negative experiences that exacerbate anxiety, and both therapies have the ability to affect positive, long-lasting change rapidly. So my research design used both quantitative and qualitative assessment. Trait scores were assessed at different points in time, and baseline measurements were used as a control indicator. 2 sessions of either CH or EMDR were given during the main study, and trait scores were assessed at baseline and 4 months and 1 year post-therapy. At baseline, there were 46 participants. At 4 months post-intervention, 34, and at 1 year, there were 17 respondents. At the same longitudinal measurement points, respondents gave qualitative self-assessment of individual music performances, documented through a log of music performances experiences post-therapy. Looking at the results, quantitative assessment of trait levels was conducted using repeated measures ANOVAs, and at both measurement points, 4 months and 1 year post-therapy, trait scores were significantly lower than baseline levels. Music performance self-assessment, using self-assessment logs of music performances, were completed at the same measurement points in time and gave valuable qualitative information on cognitions, emotions, and behavior prior to, during, and after each performance. And the logs indicated that a lowered trait level of anxiety impacted positively on the whole performing experience, resulting in fewer physiological and somatic symptoms of anxiety. There was greater overall technical accuracy with less notational and rhythmic errors, and greater fluency and overall control of the music, which led to enhanced enjoyment of the performance experience. So in conclusion, critical scientific scrutiny demonstrated that CH and EMDR decreased trait anxiety significantly below baseline levels, and that this was long-lasting. Two sessions of therapy only were needed to achieve this outcome. And performance logs indicated that a significantly lowered trait level impacted positively on cognitions and physiological and somatic symptoms of anxiety, which had a reciprocal effect on performance experience. So just summarizing, this research has shown that trait anxiety is not fixed, but mutable, and that both therapies were effective in achieving this. These findings have important implications in the broader spectrum of anxiety per se and other conditions which are anxiety-based. This research has called into question the current literature in the field, and further studies should now be conducted comparing CH and EMDR with standard practice for the reduction of anxiety. Thank you.